or play, Nicole,
Yeah.
but you might do the best.
Yep. That's I think that's what I get to do if we can't get if Patrick can't at least speak. I feel like if Patrick can speak, but he can't hear us, I'm gonna ask him to do his bit. Yeah.
Agreed.
Yeah, I
Is he
think
in
he
New-
can speak.
Is he in New York today?
Oh, he's in New York, not Sweden. That's right. Last time it was Sweden. They're changing continents, I guess. For Elancet. Sean, I also love that you will hear the seminar in stereo.
Patrick is back. Are they using?
Yeah. There's a slight lag. What comes through the wall is always
Oh,
a
Nicole,
second ahead.
can we come to your office and just sit on the floor and listen?
Yeah, come on down. I know we decided the hybrid would be too hard, and since Patrick was away, it just made sense, even though I'm sitting in my office.
Just you know, Patrick is back using his phone.
Patrick, are you able to hear us now on your phone?
You're
He's on mute.
muted.
You muted.
You're muted.
I know I'm muted.
All right.
Yeah,
I
my
can
laptop's restarting, so I'm just getting it up and running.
Patrick, since you can hear us briefly, if you do have an issue with your computer still having audio problems, you can click the mute button. There's an up caret. Switch your phone audios toward the bottom. I click that. There's a box that'll come up. You click call me. And then you enter your number there, and then Zoom will call you, and your phone will now be the speaker and microphone.
I see. Okay.
Yep,
Thanks.
and that's for everybody in any meeting in the future. It's good troubleshooting.
Good to know.
Thank you, Andy.
Great. Well, maybe we should get started, seeing as it's 12:15. Welcome, everyone, to this week's speaker series. We are so excited to have Dr. Nicole Blackstone and Dr. Patrick Webb with us, who many of you probably know, to talk about this lasting project, which stands for this Leading a Sustainability Transition in Nutrition Globally. So I'm sure many of you have seen lots of metrics and analysis about how people should choose their diet, right? To reduce greenhouse gas emissions, improve health, improve social outcomes, reduce costs. This group is going to put it all together for us. So I'm personally very excited to see how they're going to do this, and how can we really take a full understanding of what food looks like across the world and why people would choose certain diets, and how do we synthesize these research gaps in the sustainable diets space. So many of you know Dr. Nicole Blackstone. She is an assistant professor in the AFE division, Agriculture, Food and Environment, and her work fuses industrial ecology, nutrition, and social science methods. So it's really cutting edge, looking at environmental and social implications of livestock agriculture, human diets, food waste management, and regional food systems. Nicole's the lead PI of this project, and she's a co-lead on AIM 3, specifically looking at modeling sustainability outcomes of shifting diets. And Dr. Patrick Webb, of course, is the professor here at Friedman School, who describes himself as a scholar practitioner, which is excellent, working on food security, policy and practice, nutrition, agricultural development, humanitarian emergencies, and climate change, and how climate change interacts with food systems. Patrick is managing the Feed the Future Food Systems for Nutrition Innovation Lab, and is a co-lead for part of the Stop Spillover, and he's leading AIM 1 of this lasting project, reviewing gaps in diet sustainability research. So without further ado, I'll turn it over to Nicole. We're so excited to see what you've been working on. Go ahead.
Thanks so much, Erin. Well, it's a pleasure to be here virtually with everyone today. Even though Patrick and I are both faculty at the school, he is in New York right now for an Eat Lancet Commission meeting, which he'll chat a little bit about, which is really relevant to the work that we do in lasting. So we both decided to Zoom in instead of doing the hybrid format, even though I'm sitting in my office in Friedman. So we're glad to be here virtually. I will start us off by talking about our overall approach with the project and the gaps that we seek to fill, who our team is, and some just basic broad basics about what we're doing. And then Patrick, I'll hand it over to Patrick to review some of our work, and then I will kick us off to share a little bit about the modeling that we're doing and where we're headed. So as Erin mentioned, lasting stands for leading a sustainability transition in nutrition globally. So it's an ambitious title for what we hope is ambitious work. And we'll get to the real meat of, pun intended, of what this sustainability transition means in a moment. But for some context, this is a 4.5-year project that was funded by an anonymous gift through an intensive internal competition process at the Friedman School and HNRCA. We recently began year 2 of this project, so we're really just getting started, and we're going to kind of present our overall approach and how we're thinking about these challenges and some of our initial work, and there will be a lot more empirical work to be reporting out in the coming years coming from lasting. This is our core team here at Tufts. This includes the lead PIs of the project, myself, Sean, Patrick, and Feng Feng, as well as our other faculty and staff that we have associated with the project. So we've actually brought on 3 new postdocs who are working on all or in part on lasting, and we have a 4th postdoc who's starting in December. And we've got a really great team here at Tufts, but we're actually bigger than this. You can see our entire team on our website at sites.tufts.edu/lasting. We have collaborators that are working with us from Boston University, the University of Nottingham, and the College of William and Mary in Virginia. So check everyone out on the website, and you can find more about our approach there as well. So why are we here, right? Why are we doing this lasting project? Well, it's really focused on the critical importance and impacts of what we eat globally. So we know that poor diets are the main contributor to global burden of disease, accounting for 20% of premature disease-mediated mortality worldwide, with more than 3 billion people suffering from one or more manifestations of poor nutrition. So either undernutrition, overweight or obesity, and or micronutrient deficiencies. But as we know, diets impact more than our health, right? Our food choices have major implications on global climate, as Erin said, on water use and water quality, on land use and biodiversity and ecosystems, and really critical aspects of our planetary health. To get food to our tables, that requires a lot of labor and forms livelihoods for people as well. And this we've talked about less in discussions of sustainable diets, and we'll talk more about that gap in a moment. A significant fraction of the global population farms, fishes, or labors in food value chains. And this work is often low wage, dangerous, unstable, and in many cases insufficient to provide food security for the very people who are helping to feed us. And we also know, right, thinking about another side of the coin in terms of the cost of our diets, right? We know that the cost of food and its affordability is of paramount importance as to whether folks have access or not to healthy and sustainable diets, or whether they have access to healthy food at all. And it's currently rising due to inflation and the Ukraine war, COVID, all these different pressures. And with climate change and projected disruptions in the future, this is going to continue to be an issue for the global food system and for our dietary patterns around the world. So these issues that I've raised really cover what we call the 4 pillars of sustainable food systems: health, environment, social, and economic aspects of sustainability. And this way of thinking about sustainable diets really aligns with how FAO and other agenda setting bodies are starting to think about the concept. So FAO defines sustainable healthy diets as dietary patterns that promote all dimensions of individuals' health, have low environmental pressure, are accessible, affordable, equitable, and culturally acceptable. So we are really in pursuit of this idea of a sustainable healthy diet in lasting. So our goal really is to put diets at the core of science and policy to try to improve all 4 pillars of sustainability simultaneously. We know that anytime we want to implement a change in the food system, implement a policy intervention, implement a new program, implement food-based dietary guidelines, that there are going to be trade-offs and synergies. And our focus is really to think about how we can use what we eat as consumers to try to mitigate those trade-offs and improve sustainability on average overall, recognizing that there are going to be benefits and costs across the different pillars. I mentioned 4 pillars a minute ago. I think it's helpful to provide a little bit of a definition, and we've actually, as a project, had to grapple with what lives in each of these pillars because there's interconnections, they're interlocking. It's hard to think about system boundaries when you're in a complex system like this. So we've had to derive definitions for each of the pillars, which has been pretty challenging, but here's how we're thinking about the 4 pillars from our perspective for this project and for the work going forward. So for health, we're really focused on outcomes related to diseases or human well-being that have to do with nutrition. For the environment, we're thinking broadly about impacts on climate, ecosystems, and natural resources. For social, and this is the one where there's like even less kind of definitions and literature out there, we are thinking about the underlying conditions within and the impacts of food supply chains on stakeholders affected by food system functions. So the social pillar is really focused on groups of people and communities, and also animals. We're thinking about animals and animal welfare as a stakeholder as well. The economic pillar is really focused on outcomes related to consumer affordability and access to desired foods, the cost of policy action, and the viability of the underlying supply chains and institutions that bring food to our table. So this is how we are thinking about 4 pillars and operationalizing them in our project, which will come into play for both what Patrick shares about some of the initial work we've done and the modeling work I'm going to share. So conveniently, we have 4 pillars, and we also have 4 specific aims for our work. These aims overall focus on developing metrics and methods to estimate diet-related outcomes across the 4 pillars of sustainability, and also identifying evidence-based interventions to shift diets toward more sustainable outcomes. We also have a priority to bring together and build capacity at the school. That really lives in aim 4 of the work, to really try to leverage what we see as strong and global leadership in different aspects of sustainable diets. We really want to bring folks from across Friedman and across Tufts and the greater community to build capacity and really set us up to lead in this space on healthy diets from sustainable food systems. And we're doing this through convenings, through hiring staff and building capacity, grant writing, and curriculum development. But for most of the time today, we're going to talk about the science. So I am going to hand it over to Patrick to highlight a sample of review activities that we've started doing. And then Patrick will hand it back to me and I will talk more about the modeling. So Patrick, the floor is yours.
Thank you, Nicole. And great to see so many people interested in this. What a great pleasure it is to work on at this amazing intersection across not just Friedman programs, but disciplines and ways of thinking and approaches. If anything, this is a true reflection of how Friedman works and could work still further, but it's hard. And I say that because while many people have talked about these intersections and the role of diet at the core of human and planetary health, very few have pursued analytically how to best measure this and what is the evidence base we can generate to inform policy and search for solutions. So under aim 1 of the 4 aims, essentially review what is out there, particularly since 2015, 2016, there's been really a lively uptick in terms of publication in this space using this terminology, this language, but then not always being as transparent in the assumptions, the choice of indicators, the approaches used, and making it actually quite hard to compare. We'll come back to that. But so our first step was to look at the published literature of recent years and figure out who's done what can we build on, and where are the gaps. Next slide, please. So I'm sitting in New York at the second meeting of the Eat Lancet 2.0 Commission, and I'm just saying that because in many ways everything I'm hearing as in the first 6 months of this new Eat Lancet agenda confirms the need for what Lasting is trying to do. Others are doing other things. Now, the Eat Lancet 2.0 will be different. It will be the same in terms of updating prior analyses, but it will be new in a variety of ways. One of those is we now have data on more environmental or planetary boundaries to look at than before. It's going to go from 6 to 8 or 9. Next slide, please. There's going to be more attention to some of the important issues that Nicole just laid out, to try and first better acknowledge that there's no one diet there's no one global reference diet that is going to serve everyone well. That there's going to be multiple diets for for many different people, and that we need to better understand regional and local diets to be able to understand the food systems that underpin those diets and the search for solutions. Ultra-processed foods, breast milk, implications of those, for example, were not really addressed in the first round. They are being highly debated in a room just down the corridor right now. So that, again, not just looking at main staple foods, but what the ultra-processed and just processed foods and breast milk. An important one to point out is that Eat Lancet 1 was very much production focused. Really, pretty much all the assessment was framed around agriculture, the production of food, paid lip service to food systems, but in fact it was all about agriculture. And so now there's much greater recognition of understanding both the contribution to emissions of value chain activities relating to food, which can be as much of a third of all greenhouse gas emissions, are post-farm gate, when that kind of thing was not included, but also energy gains and emissions reduction, and potentially carbon sequestration. Who knows what other solutions can be found in the whole value chain approach, including reduced food loss of waste. There's going to be addressing multiple pathways, scenarios of various kinds, and a big new focus on justice and a just transition. And as Nicole mentioned, this is seen as core now to the way Lancet has to think and act. But how do we do that? How do we get there remains a big open question. Next slide, please. So very quickly, we've done pretty much a systematic review approach to identifying those papers, peer-reviewed papers that have been published, that look at dietary patterns at the core and how those dietary patterns interact with two or more of the pillars that Nicole laid out, whether the planetary environment dimensions, the human health and nutrition, the economic or the social. It's a huge range of search terms. Next, please. Going through the conventional approach that from 15 to the end of last December. The core being that they have to be not conceptual. There's a lot of conceptual papers out there talking about this stuff, but these are those who have created models to try and understand how dietary patterns and or changes in dietary patterns or elements of those diets impact at least 2 of those pillars. Ideally more. Ideally, we could see 3 or 4. About 2,500 papers identified. We've gone through a very long and exhaustive process to end up with maybe 63. I'm still not sure. I think it may end up being even less than that, maybe 60. But we're almost at the end of that intensive process that has been quite a challenge in terms of definitions, lack of transparency in the papers themselves, how they make data choices, and so on. Next, please. And just broad brush, these are preliminary data, but findings, but here's what we're getting. As I mentioned, a big uptick, particularly since 2017, in publications that are addressing multiple dimensions and multiple pillars over time. And I'm sure 2022 will continue on the surge upwards. But the distribution of those papers, as you can see from the map, high geographic concentration to high income parts of the world, primarily. Yes, there's India and China increasingly. But the rest of the world is missing. And it's missing for a lot of reasons, often data gaps, often that prevent the bringing together of the right kinds of data sets, right kinds of indicators to be able to do these kinds of analyses. Next slide. And so preliminary again, but what we're seeing is that uptick in papers that address at least 2 of those pillars. Some are tackling 3. We've only so far found maybe 2 that include all 4. 2 papers in the entire globe of published literature that actually even attempted to try to bring all 4 pillars together. The biggest gaps in the pillar choice in terms of indicators, metrics, and analysis are those relating to the economic dimensions and the social dimensions. Much more to human health and nutrition, climate and environment, obviously, that's where this all started. Far, far less in social and economic. And that's really where we need to go. Real problem with the assumptions and data gaps and proxies that are unvalidated and methodological opaqueness. And we are going, I think lasting is actually going to make quite an impact in terms of critiquing and making these things clear so that we can, as a community, better understand what can be harmonized, what is standardized, and where are the big gaps going forward that we need to address. I mentioned lack of studies, the lack of geographic representation. It's particularly bad for low and middle income countries, and that is something that we have to work on if we're going to be serious about understanding the implications of dietary change, not just in one country or another, but across the globe, given the diversity of those diets in the first place. Very few, if any, have tried to incorporate processed foods. They typically address food through a commodity lens, and food groups. And so they're very hard to, as we know, to disentangle composite foods like pizza or ready-to-eat foods that are microwave friendly, whatever it is. But disentangling ingredients is a challenge, and it is one of those challenges that we're taking on, that Fang and Sean are addressing very, very well. And then finally, very few really draw out implications for policymakers of their findings. They're very much focused on, we need more research, and this tells us what we have just found. But how do we use that to inform policy? How do we use that to build up an evidence base that policymakers across the globe will find compelling and convincing in ways that they want to support dietary change as part of their agenda to stay within planetary boundaries and improve health and improve the affordability of these dietary patterns and ensure social justice and a just transition as we move towards a sustainable food system. Boy, these are complex issues, but we're doing absolutely our best to not dumb them down and not simplify them, to really embrace that complexity, but address the analyses in ways that will be compelling and generate, hopefully, action-oriented solutions. So I'll stop there and pass back to Nicole with more forward-looking, the forward-looking agenda.
Sure. Thanks, Patrick. So in terms of our next steps from this review work, which we'll talk about some of those next steps now, with AIM-3, we're working on building a model to estimate the 4-pillar sustainability impacts of shifting to recommended diets and implementing population-based dietary interventions in the United States. So we're a project with global ambition, but you have to start somewhere. And so we are starting with the United States as a case study, which in some cases was just a choice of convenience, because many of us work here already, have existing literature and familiarity with data sets. On the one hand, it's a great case study because the data quality that we have in the United States is really high in terms of dietary intake data and associated data sets, which is great. But on the other hand, right, that means that when we think about how to scale this out to other countries, how to apply this kind of approach to other countries, we're going to need to be thinking innovatively about how to do more with less, or about what the policy asks are around, essential data needs that are needed to do this kind of work in a low and middle income country context, for example, where we don't have, an NHANES analog. So we're starting in the US, taking what we learn here to try to be able to synthesize learnings and approaches for other contexts as well. Those would be follow-on projects after we kind of get this core work going. We're also working on deriving data for the social pillar, because you can't model 4 pillars impacts if you don't have any data for one of the pillars. So I'll talk a little bit about that data development project. That's a collaboration with the University of Nottingham. And then we are looking at conducting consumer studies to understand what aspects of sustainability that consumers may or may not really care about. And that work is being led by Sean Cash. And then, as I mentioned, we are really hoping to expand this modeling and integrated approach to other country contexts after the project ends, for sustainability and for transformation purposes. So specifically, I'll talk a little bit about the modeling work that we are doing in AIM-3. The modeling exercise is being led by myself and Fangfang Zhang, and we are really aiming to model 4 pillars impacts of US dietary shifts. So the data, and we don't have results yet, like cat out of the bag, we don't have results. So I'm gonna, in broad strokes, describe our approach, and I'll spend a little bit more time on some single pillar data development and single pillar results that we have, because we're still in the process of building this and integrating data across the pillars. So for our environmental pillar, just to talk about the indicators that we're using, we're looking at climate, energy, and water related impacts right now with the data that we have. For health, we're leveraging the amazing work on comparative risk assessment modeling that comes out of the Friedman School, and looking at simulated deaths from cardiovascular disease and cancer associated with changes in dietary patterns. We're looking at diet cost. And our one social indicator is the risk of forced labor embedded in the value chains that supply foods to these diets. And I'll talk more about, this is probably a really new indicator for most folks in this crowd. I'll talk more about that data and metric and what it means. So our core activities in this AIM and AIM-3 kind of go in 3 buckets. We're doing model development, which we're integrating kind of 2 families of models to be able to simulate these 4 pillars impacts. So We're taking the comparative risk assessment approach that Feng Feng and Dari's lab really use in their nutrition epi work. And we're pairing that with a modeling approach more in the sustainability realm, where we can look at the social and environmental impacts of the supply chains that are providing the food for the diets. So we're integrating these together in one framework and figuring out how to do that, figuring out how to get the data to talk to each other, and that's ongoing work. This model is built on NHANES dietary data. So when we look at one dietary pattern compared to another, or the impact of a policy intervention, that's really built on an understanding of what people currently eat using NHANES. So it's based on actual food consumption data, which in many cases is fairly novel in this space, because often what is used for it's a proxy for food consumption. Often at the country level, food balance sheets are used as a proxy for food consumption. So we're actually using intake data as the backbone of this model to look at simulated impacts. We're developing data for the social pillar, as I mentioned, and this is the forced labor risk of food products consumed in the US. So this actually isn't just commodities, it's food products. We look at risk in agriculture and manufacturing stages. And then we're developing scenarios and analytical approaches to be able to look at different policy interventions, different dietary pattern comparisons, et cetera. One kind of big picture comment that I slotted in here, but it applies to our whole approach as a project. We're really focused, we've honed in on this major data cap in the social pillar. And so we're really focused on that and getting good data to be able to run 4 pillars analysis and inform policy holistically. But social equity and social justice actually cut across the pillars, and they cut across how we do research as well. So we are thinking about social equity in multiple ways in this project. And I'll just share that we're trying to approach this with a sense of humility, and that we don't know all of the right answers, but we as a team are really interested and open to learning and thinking about how we do analysis differently, discuss results differently, what we need to learn as researchers to really advance an equity lens in the work. And so we're thinking about social equity in terms of the outcomes that we're studying. So forced labor is an equity related outcome. We're thinking about social equity in the structure of our modeling. So the way that we have structured the model is that we're able to look at distributional effects within a population in a country. We can look at the impacts that are affecting one subpopulation versus another, right? It's not just a country level view, it's sub-country level view, so we can see diversity of impacts and differences across different subpopulations. We're trying to think about social equity and how we interpret our results, and talking about structural factors that are at play here, where we see differential outcomes, how we engage with the public and translate this work. And we, as a research team, I'll just put out there for other researchers who are part of the seminar today, we are trying to invest in continuous learning for our team. So we started this summer with a training session with Tiffany House in the Provost office on how we think about an equity lens in our research process. And it was, one 90-minute session, and we're trying to commit to do at least one session per semester, so we can keep learning and thinking and discussing about how we can advance this as a team. Because we don't know all the answers, but we're sure as heck trying to do our best. So quickly, this aim, we're looking at modeling 4 pillars impacts of dietary shifts. I'll just share a little bit about the data and initial analyses we have for the forced labor aspect of the work, and then diet costs for the US. So I'll give a little bit of background for forced labor, because this is probably the least familiar out of all the concepts that we're talking about here. So forced labor is a situation where folks are coerced to work through either kind of implicit coercion or violence or intimidation. There are really coarse numbers around the incidence of forced labor in agriculture and food systems broadly. They're actually aren't estimates of how much forced labor is in food systems. The best available data we have is just specific to ag, fishing, and forestry. And forced labor, eliminating forced and child labor, it's a critical aspect of achieving a sustainable development goal. So often in our Friedman community and spaces, we talk about SDG 2, zero hunger. We are bringing in other SDGs here by using this 4 pillars approach. So forced labor is a really critical issue, in particular for the agriculture sector as it relates to food systems. We are assessing risk of forced labor in upstream value chains using a social life cycle assessment approach. I'm going to talk pretty quickly about this, but I will say if you're interested in social LCA and these kind of methods and metrics, Sean Cash and I teach a corporate social responsibility class in the spring. That includes a section on sustainability metrics and reporting. We talk a little bit about social LCA there. I also teach an environmental LCA class in the spring if you're interested in the environmental aspect of this. But essentially, this is just a method that allows us to try to estimate social impacts for a product. So the same way we can look at a carbon footprint for a hamburger, you could think analogously, we could think about the social impact of a hamburger. With the social LCA, I gave the environmental LCA analog. So for those of you who have any exposure to the climate change literature, this may look like a familiar concept to you. So in environmental LCA, we measure things in carbon equivalents, and that's how we take a bunch of different gases and we put them on the same basis and say, this is the carbon impact of a hamburger. We do this using a tool called environmental life cycle assessment, or LCA. We can do the same thing, albeit with a different kind of approach in social LCA. So we, instead of thinking about impact on climate, we could think about impact on workers as an example. And we could take things that are like qualitative assessments of risk and translate them into quantitative units. An example would be something like a medium risk hour equivalent is how we would talk about this in social LCA spaces. Is one option for how you might take qualitative data on risk and translate it into a quantitative estimate. And I'm not going to go into the nitty gritty here, but I'll show some results of what this kind of study looks like and how this plugs into the modeling work that we're doing. So this is actually risk of forced labor, and the unit is medium risk hours equivalent per serving of all of the fruit consumed in the United States. There are probably omissions, right? It's not all of it, but the major fruits consumed in the United States. This was derived using a social LCA approach. We actually published this in Nature Food last year. And this shows the dots are a weighted mean risk measured in this medium risk hour equivalent. And the ends of the bars are the minimum and maximum risk for that product, which are a function of essentially where they're from and what the risk level is in that supply chain where they're from. So this is a way to actually take qualitative data and turn it into a quantitative estimate of risk that we can then look at in the context of diets, in the context of policy decisions, et cetera. So it's a way to bring social, or a labor indicator to the table, to the same table as climate and mortality from cardiovascular disease, et cetera. Just briefly, we found that really risky fruits include raspberries, citrus, pineapple, orange, or lemons, and avocados. Those of you who love avocados, there's actually a lot of forced labor risk in avocados. Anyway, so this is an example of the type of data that we're generating that we feed into the model to then look at impacts of entire dietary patterns. All right, here's another an example from a different pillar, and then we're going to wrap in a second, so we have some time for questions. This example is looking at, the analysis has been completed here. This is looking at per capita costs of foods from grocery stores in the United States. So this analysis has been led by Jessie Lan, who was a former master's student, and Fangfang Zhang, as part of getting data together to put into this model. This is sort of a initial output that we'll then kind of put into the bigger model on 4 pillars. So just some preliminary results looking at grocery food costs. This is an analysis using a newer database from the Department of Agriculture called the Purchase to Plate database. It's in progress now. These aren't final results, but we found that on average across the US population, folks are spending the most at the grocery store on beverages, interesting, and on animal source proteins at the grocery. So when folks go to the grocery store, animal source proteins, beverages, and mixed dishes. So this is the category in NHANES. So this data set, we map NHANES to costs, and then we're able to look at the cost associated with what people are actually eating. So this will get folded into the 4 pillars model that we're talking about. But I'm hoping Fang Fang is on and she can answer any questions folks have about this paper if there are questions. But that's so 2 examples of social data that we're generating, economic data that we're manipulating and mapping to dietary patterns. Because our ultimate goal is, as Patrick said, to bring all of this together in a holistic framework to be able to identify trade-offs and make sense of this complexity for decision makers, right? So instead of just having the paper with the discussion section that says we need more research, we're really trying to in some ways pilot different ways of how to synthesize this complexity without losing the forest for the trees, I suppose, or oversimplifying in a way that's unhelpful. Because, for example, that's a complaint often with single score approaches. Often folks want one number, like you want one number that says, is this system better than this system? But there are drawbacks to that type of approach. So we're looking at different ways we can deal with this complexity and how to best package it so that it resonates with policymakers and actually can hopefully result in some change. So, and Patrick, I think Patrick and Fang Fang put a note in the chat up front, and I failed to mention that we have several students associated with the project. We've had RAs in the past who have graduated. We love working with students and lasting, and there are several vehicles to get involved. If you are a student and you're interested in this kind of work and you want to engage with us in some way, we're currently hiring for at least 1 RA to work on the consumer and expert facing work that Sean is leading. We've discussed a possibility of having research-based internships next summer. If this is an area that you're interested in, we don't have anything formulated, but if you're interested in a research-based internship, come talk with one of us and we'd be happy to kind of think through things with you and see what may be possible. And then directed studies, like this work, there's so much work to do. As Patrick mentioned, the space is wide open in many ways, and we're thinking about putting together a directed study for the spring, looking at what's the evidence base for different policy interventions that we could be looking at with our modeling for dietary patterns. So if you're interested in that, if you're interested in policy effectiveness, interventions in this space, shoot myself or Julia Madison an email, and we'll see if we have a critical mass of students who may be interested in working on this together with us. And that's it. Patrick and I aim to go short so that we actually had time for questions, because that often doesn't happen in seminars. And I think we achieved our goal. So we really welcome your questions and comments and engagement in any way in this project. And as I said, we're toward the beginning of this journey, and there will be more to come in coming years around the science and recommendations from the project. So stay tuned and come chat with us if you're interested in being involved.
Thank you, Nicole, and thank you, Patrick. We could do maybe Zoom applause if you want to stick the applause symbol, because we're not in person, but that was wonderful, super interesting. I have 10,000 questions, but
Great.
Maybe I'll open it to the audience first. People can just raise their hands, and I don't know if, yeah, here, go ahead. Why don't you go ahead, Megan, and then we can read what Jenny Coates put in the chat to see if it's a question or not. Go ahead, Megan.
Yeah, thank you. Thank you, Nicole and Patrick. That was a fascinating presentation. It's such an interesting project and exciting to see the progress that you've made so far. I had also a million questions, but I guess probably the most pressing, or not pressing, but the most, I think the priority questions I would have are, so when you were talking about like this, the social LCA and environmental LCA, it was at the like individual food or product level, but for the diet, for the and I think also for the cost. But when you were talking about diet and health outcomes, is that, are you modeling impacts on health outcomes at the dietary pattern level or individual food level? Because I would love to see, I think that you're probably doing dietary pattern, but if you're doing food level, I would be really interested to hear a little bit more about that.
This is a great question. And it's something that we've grappled with as a project, because we have data at different levels of resolution that we're integrating and trying to figure out how to essentially harmonize our approach. So I went back to this slide because to just walk through a concrete answer to your question, Megan. So for our climate, energy, and water data, we're actually using a couple of data sets that have impact at the level of foods and NHANES. So it's pizza, hamburgers, et cetera. It's food level, product level data. For risk of forced labor, we're not there yet, but we're close. It's going to be food level data. It's going to be the same sort of thing. Diet cost, food level data. CVD and cancer mortality, food, dietary factor level data, right? So we are, because the relative risk, the relative risk data is at the level of dietary factors, like fruits and vegetables or whole grains, right? So we're actually creating an approach so that we can aggregate and disaggregate data in different ways, for lack of a better term. So like when we're looking at differences in dietary patterns, we're looking at shifts in food groups, but underneath the food groups is either a change in a dietary factor for the epi data, or like a change in the whole composite of foods that make up that food group that gets shifted, if that makes sense. So it's like, it's both. We have food level data and dietary factor level data that are being integrated into the model.
So you wouldn't be able to distinguish between, say, plain yogurt and a yogurt that's filled with added sugars in this scenario, because yogurt has like objective relative risk for health outcomes, but then you won't necessarily get like the effects that added sugar would have. If it's like a, you know, Yoplait super sugary yogurt or something like that.
Yeah. I'm going to defer to Fong on that, but I don't think added sugar is a dietary factor that we have in the analysis. I think we have SSBs. So we're not able to look at like differences in health outcomes from that, but like the difference in the underlying environmental impact would be different.
Definitely. Okay.
But it'd be marginal at best.
Thank you.
Yeah. And the social risk would be different too, because sugar is a high risk commodity. Okay.
Great. I think our next question is in the chat from Regen Ford, who might want to read it out loud. Go ahead.
Where is it?
It's okay. If they don't want to read it out loud, it just, they wrote, curious if the risk of forced labor includes, oh, go ahead.
Hi, I'm sorry. I'm in
Okay.
California, where we just passed legislation to empower our farm workers to actually try to unionize. And there's been a lot of initiative addressed at even supporting our non-documented workers in terms of getting SNAP benefits. So I'm just curious if your forced labor metric addresses undocumented workers.
So it would, documentation status doesn't affect whether there are indicators of forced labor in the system. So it doesn't matter if the workers are documented or not. If there are indicators of forced labor happening in that commodities supply chain or in the country or in the sector, it sort of depends on what level of data is available. We take the highest resolution data available, then it would be captured. There are huge data gaps though, and issues with undocumented folks not wanting to report things, not passing information on to NGOs even. So in theory, yes, it includes undocumented workers. In practice, there's probably a huge missing data issue there because of the invisibility undocumented workers in any kind of exercise like this. So it's probably drastically underreported for undocumented workers, would be my assessment.
Have you worked with any like nonprofits that are specifically addressing these workers' rights as a way to collect data?
Not yet. Jess Sparks, who is kind of co-lead on the forced labor data aspect of the work, does a ton of primary data and collaboration work with, in particular with fisheries, and increasingly with agricultural organizations. She does a lot of work with the Fair Food Program, for example. So we were thinking about it as a potential data source down the road, but right now we were using secondary data as kind of a scan level exercise to just put this out there and be able to talk about big data gaps where primary data is really needed. So yeah, that's future work, I think, on the forced labor thing.
Okay, thank you.
Great.
Thanks for that
And it'd
question.
be interesting to see how to even figure out the error bars on that. But next we can go to Mai Chung had the next question.
And May, hi. So wonderful presentation. I guess I'm going to ask perhaps this provocative question. So a lot of this work actually reminded me USDA's food-based dietary diet pattern analysis, which is a big part of analysis that USDA did to come up with dietary guidelines. But of course, they only focus on one pillar, which is the health outcome pillars. So my question is, well, and for whatever reason, dietary guidelines does not consider cost, or they were told they should not consider cost in their analysis. So my question is, this is wonderful, but how can we convince? How can we kind of work with policymakers or overcome maybe politics or a lot of challenges to basically push this paradigm shift to consider 4 pillars. Dietary guideline group was told they cannot consider environmental impact of their recommendation because, quote unquote, outside of their expertise.
Mm-hmm. Yeah. Patrick, do you want to take the policy question first?
Yeah, okay. You know, the naughty side of me would say, who cares about dietary guidelines? No one follows them anyway, right? But of course, they are super important in so many ways in guiding the construction and design of programs, particularly in the US. Not so much elsewhere, but certainly in the US. I think this is, you're right, May. We almost certainly need to engage with policymakers of various kinds, various colors, early on. That was, for example, many people don't know that the experiential index that measures household food insecurity and hunger was much of the work was done at Tufts in this school, the inception work along with Cornell, and it took a lot of work, almost in collaboration with USDA over many years to actually get that adopted, against the opposition of many states and politicians who didn't want such a metric because it's obvious, right? We don't have hunger in Texas, so therefore we don't want to measure it, right? And if we don't measure it, we don't have it. So I think it is a process of engagement, and that is part of our agenda. And Nicole mentioned outreach and engagement and dialogue. And so we are going to seek to do that. But importantly, equally importantly, is we have to try and influence the science community that this kind of transdisciplinary work, can be done and comes up with meaningful findings that then can be replicated and expanded on to influence policy. And then finally, I would just say that, you know, some of the advocates on the policy side could come from the other pillars, right? So by, you know, it's one thing to define what we need to achieve in health, but in setting the guardrails for planetary boundaries or social justice, and then defining dietary patterns that can keep us within those guardrails, would be an important new paradigm of data generation and thinking, right? And so I think for those reasons, it's really important to do this, but engage early on to make sure that policymakers understand what we're trying to do. Nicole.
Yeah, and I'll just add, well said, Patrick. I don't have much to add. I'll just say that I think this idea of expanding out to multiple pillars gives us multiple options. It gives us multiple options to think about what resonates with different policymakers, like Patrick was saying. And this really mirrors, I think, a lot of the coalition building that is happening in the sustainable food system space. You know, we see organizations like the National Sustainable Agriculture Coalition and other farm coalitions starting to partner with coalitions of workers, starting to partner with, you know, the nutrition ag partnerships have been around for a long time in the US with the Farm Bill. But we're seeing these coalitions diversify to actually reflect more of this 4 pillars type of approach. So I think there's value in that and thinking about what are the entry points for different folks, although it is an uphill climb.
Great. And over to Dr. Solomon Acer.
Yes, good morning. Can you hear me?
Mm-hmm.
I just want to put 2 words on the table. This has been very interesting. And the 2 words are pet foods. And I recently saw an article, not in a scientific journal, on CNN News, in which it said that if all of the cats and dogs in American households were a nation, they would be 5th in the world in consumption of animal foods after China, Brazil, United States, and Russia. So that's an interesting observation. And I think it's worth looking at when we're thinking about the environmental aspects of food production.
Yeah, so I love that you brought that up, Solomon. I think, so that's sort of pet food is out of our purview with this, the space is big enough. We've already had a hard enough time narrowing down what on earth we're gonna do with this project because there are so many wide open gaps to be filled. But I will say just a perspective, just to add some perspective on that, that really illustrates the kind of lock-in of livestock systems. Like there's so much energy and, you know, ink spilled about and action around we need to reduce animal source food consumption in high income countries where it's high. Like we really need to be working on this. But that what you've just shared demonstrates the complexity and the interlocking systems about doing that, right? So we've created a system where part of the livestock system feeds people, part of it feeds our pets, part of it goes into the pharmaceutical industry, part of it goes into a diverse array of economic sectors. And so if we're actually thinking that more sustainable diets include fewer animal source food, there's a whole lot of reorganization that needs to happen in these interwoven systems. That makes the lock-in more difficult to deal with. So I appreciate, we can't do it to pet food in the analysis, but I appreciate that kind of shedding light on the complexity here and what it would mean to actually transition to an economy that's less dependent on livestock agriculture.
Pet food's very interesting in a lot of ways also though, because there's a lot of the sourcing. Certainly, if you think in a US context, a lot of the sourcing are things that will go into pet food systems that are not a priority for human consumption, right? And so there are complementarities as well as tensions, you know, and for example, in working with some of our colleagues at the vet school, and I just shared a commentary from a few years ago that came out of our vet school, but you know, this move towards anthropomorphized diets for pets is both nutritionally and environmentally not very defensible. You know, right? It's something that connects with a high value product that where there's a profit margin involved, but it's, you know, it gets rid of some of these complementarities. It's not really good for the pets in most cases. So yeah, it is a bit outside of scope of what we're doing at Lasting, but it's you know, it's and it is a huge impact. But I think that some of these measures also are engaging in, fortunately, a little bit of double counting.
Complicated. Patrick, did you want to add to this?
Yeah, no, I was actually going to say the same as Sean, that some waste would go up, some food loss and waste would go up if it didn't go to feed animals. But we shouldn't forget the processing and packaging, processing emissions, packaging, transportation dimensions of pet foods in terms, you know, so it is a component, and we're not going to explicitly take it on, but it is, yes, something we need to take seriously.
As maybe a last question just to wrap up, because we've got 2 more minutes. I think what was interesting for me in particular is this tension between aggregating metrics and disaggregating them. And so I was wondering if you could give maybe a couple examples of how you would make those decisions for specific policies that you would want to influence, right? So if you overly aggregate, a policymaker doesn't see their remit in your number or in your research results, right? So I don't know if you have examples of specific policies or practitioners that you're looking to influence, and kind of we could finish off that way. Go ahead.
Oh yeah, that's a great question, Erin. Well, we haven't yet identified the suite of interventions we're going to be looking at. Right now, the modeling exercise we're going through is essentially comparing current consumption to recommended patterns. So we're doing pattern level analysis, and then our plan is to move to the intervention focused analysis starting next year. But that question of resolution, I think, is going to come up as we design what we're going to focus on for intervention points. You know, when we wrote the proposal, we wrote a subset of, we were thinking about it from the epi lens and where there's, you know, the relative risk data, and we know some things about the performance of the other aspects of sustainability. So we thought, like, for example, seafood could be a really interesting set of products to look at because there's omega-3, like high omega-3 seafood as an example, because there's the health benefits, there are environmental risks, and they're better in some ways than other terrestrial protein systems. But then the labor conditions in a lot of seafood systems are absolutely abysmal. But it's specific to species. So this is where we would actually need to think really carefully about what the intervention is that we would be looking at. Is it a subsidy for a particular, is it for canned tuna? Is it, you know, that kind of thing? So I really appreciate that question, and I don't have an answer for you, but we'll be thinking about that starting this spring as we shift to the intervention modeling. Yeah,
Fantastic.
Patrick, and that's right. We have to allow for substitutability.
So complex. I think it's really impressive, the complexity of what you're tackling. So thank you so much for the presentation and for fielding all these questions and engaging with everyone. I think we're all going to stay tuned and look forward to seeing what you come up with. So we could do virtual applause again. And thanks everyone for joining.
Thanks, everyone.
Thanks, everybody. It was a pleasure.
Thank you.